Hi guys, Dr. Rob Barrington here with some more nutrition advice. I'd like to talk today about iron and its absorption and how we can improve its absorption. Now iron's worthy of consideration nutritionally because it is an essential element. We do require it for the formation of hemoglobin. It's also part of the myoglobin molecule. And it acts as a cofactor in a number of enzymes. Some of the best known of these are tyrosine hydroxylase and tryptophan hydroxylase, which allow the formation of serotonin, norepinephrine, epinephrine, and also dopamine in the brain. So it's important for the formation of neurotransmitters. It's important for the transport of oxygen around the blood, and it's important for the passing of that oxygen into skeletal muscles. Iron deficient anemia is the most common deficiency in the world, and many people in the West, in developing countries, still develop iron deficient anemia. Female athletes are one of the highest risk groups for iron deficient anemia, but anybody can get it. You only have to have a poor diet for a short amount of time and be performing intense physical activity. It's very, very easy to get iron deficient anemia, particularly if you don't eat red meat. So that brings us to red meat, very good source of iron in our diets. The iron in red meat is very well absorbed. The reason for this is that in the animal tissues, the iron is bound to proteins, forming the hemoglobin and myoglobin molecules, just as they do in our tissues. And the formation of those protein complexes increases the absorption into the enterocytes. So we consume the animal tissue, the iron bound to protein passes through our stomach into our intestines. It's absorbed across the intestinal tract wall into the enterocytes, where the Fe2+, the ferrous form of the iron is released. The Fe2+ then passes through a transport system and into the blood, and that's a very efficient system. That's how we really should be getting our iron. It's a very high absorption of iron from red meat, and you only have to eat red meat a couple of times a week, and you can supply all of the iron that you need for your metabolic needs. Now, beans are also a very good source of iron, but as with all plant material, the iron is very poorly absorbed from plants. Now, the reason for this, well, there's many reasons. Let's go through the reasons as to why the iron is poorly absorbed from plants. Firstly, the iron is bound to complexes within the plants. The plant tissues bind the iron, and much of the iron is never absorbed from plants. It passes straight through us because the plant tissues make the iron insoluble. It's not possible to absorb it. So we eat some legumes. Let's say we eat some soya beans. The iron, all things being considered, the iron bioavailability from soybeans is about 2%, so it's very low. We eat the legumes, we eat the soya beans, they're in our stomach, and some of the iron is released as the ferric form, which is the Fe3+ in the stomach, and that is converted then to the Fe2+ ferrous form of iron in the stomach because of the low pH in the stomach. This Fe2+ ferrous form then passes into the small intestine, where it is converted back to the Fe3+ form. So what we have effectively done is we've liberated some of the iron from the plant tissue, and it's now in the small intestine in this Fe3+ state. Now, unfortunately, this is very poorly absorbed in the intestines. The Fe3+, the ferric form of iron, is not well absorbed across the enterocyte wall, and it's very insoluble. So it's poorly absorbed. Some of it actually binds to hydroxide ions and forms ferric hydroxide, and that's completely insoluble, and that is excreted. So this is the reason that the non-haem iron, the plant form iron, is very poorly absorbed in humans. We need it in the small intestines in the Fe2+ state, ideally bound to protein. And in plants, neither of those conditions apply, and therefore it's very poorly absorbed. So if you do get your iron, you rely on plants for your iron, you need to make sure that you're very careful with how you take your food, because there are certain things that act as inhibitors of iron absorption, and there are certain factors in the diet that also act as enhancers of iron absorption. Now, if we consume some iron from non-haem iron from plants at the same time as about 80 milligrams of vitamin C, the vitamin C passes into the small intestine with the non-haem iron, and it actually converts the Fe3 plus ferric iron into Fe2 plus ferrous iron. And that makes it more absorbable. And about 80 milligrams of vitamin C can increase the absorption of soybeans from about 2% to about 8%. It's still not great, but it does make a difference. So vitamin C and other reducing agents too, it doesn't have to be vitamin C, other reducing agents as well, will improve the absorption of the non-haem iron from plants. And this is why quite often when you go into a supplement shop and you look at the iron supplements, they quite often do come with vitamin C in the tablet. Another thing that's worthy of consideration is tea. One of the reasons that the absorption of iron from plants is actually quite poor is because there are tannins and phytate within the legumes, and they are thought to perhaps be able to bind to the iron and prevent its release into our stomachs. Now, tea also contains tannins, so there is some suggestion in the nutritional literature that tea can actually inhibit the absorption of plant-based iron. But it's controversial because if we look at legumes, they contain tannins, they contain phytate. If we remove the tannins and the phytate from legumes, and scientific experiments have done this, the absorption is not really increased that greatly. So this is not the main factor in the poor absorption of plant-based iron. So although tea has got a bad name for causing a decrease in the absorption of iron, it's very controversial, and whether that's actually the mechanism of how that prevents the absorption it's not really known. I would suggest that if you're borderline iron deficient, you wouldn't take the risk and consume tea with your iron. But for most people, I don't think it's a big factor. And if you take your iron in the animal form, in the haem form, from red meat, tea is really not going to have any effect at all. The iron is very well absorbed from red meat. So there's some considerations for consuming iron. If we have a look in supplements, most of the iron in multivitamins, in supplements, is in a form something like ferrous sulfate. There's evidence that if you amino acid chelate the iron in a supplement form, so that's really wrapping it in a protein, that's very similar to the way the iron is found in hemoglobin and myoglobin. So amino acid chelated iron is probably much better absorbed. The absorption probably pass up to about 40%. It's probably much better absorbed than some of the inorganic forms of iron, such as ferrous sulfate, which is not really that much better absorbed than the iron in plants. So if you have a look at your multivitamin, or you want to take an iron supplement, really look for an iron that's bound to protein, and that would be called an amino acid chelate. It's just simply wrapping the iron in a protein, and this is what our enterocytes recognize. They want to absorb the iron wrapped in a protein because that protein passes the iron into the enterocytes, and then the Fe2 plus iron, the ferrous iron, is released, and that's the form that the body wants to transport and utilize. So there's some considerations for iron. You have to be careful if you exercise very intensely, your requirement for iron goes up, and obviously female athletes do require more iron generally than normal females, because this exercise does increase the requirement for iron, because iron is so important for transporting oxygen around the body. If you don't eat red meat, you do have to be careful of your iron intake. Although you might be told that legumes are a very good source of iron, and they are, you do have to take into account that the iron is not very well absorbed. You could consider an amino acid chelate supplement, as mentioned. You should get iron in your multivitamin. However, if you do consume red meat, really, if you consume red meat a couple of times a week, you should be getting all the iron you need. You should really be taking a multivitamin anyway, even if you're consuming a high quality diet. And your multivitamin should contain probably around 15 milligrams of iron anyway. So iron in most people is actually a problem. Most people actually get too much iron. It's a very small percentage of the population that get too little. And those are the people that really have to give consideration and make sure they've got a really good diet, make sure they've got a high quality diet, high quality sources of iron. And if you do rely on plant foods for your iron, take it with some vitamin C and try and avoid taking it at the same time as tea because the tannins may decrease the absorption.